Recording in progress.
Hi, everyone. Welcome. My name is Kelly Chapman. I am the Senior Program Coordinator here at the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We're so glad to have you today for our webinar on Medicaid Managed Care and School Mental Health. Today's webinar will continue until 1 p.m. Eastern. And again, we're so glad you're here. We encourage you to introduce yourself in the chat. Let us know your name, where you're joining us from, and your role. Also, if there are any technical difficulties for you during the course of our presentation, please let us know in the chat and someone from our team will assist you. And if you have resources that you would like to share with others in the course of the presentation, we encourage you to do that in the chat as well. During the course of our presentation, we will share a link to a brief survey. It's very brief and has 2 parts, so be sure to complete both parts. And I'd like to highlight that after completing the second part, you will have access to a certificate of attendance for today's session if that is something that you need. Before we get into the session, we have a quick disclaimer. Adam, for me, this slide is showing up. I can only see half of it, so I don't know if there's a way to kind of zoom out, or perhaps Josie or Jackie in the chat could say if it's showing up the same way for them. But I will continue with the disclaimer. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies for the Center of Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. And then today's session is brought to you by the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We are located in Atlanta, Georgia, at Emory University Rollins School of Public Health, and we are proud to serve the 8 states in HHS Region 4 that you see pictured here. It'll come up on the slide in a moment. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems, which provides us with a unique lens through which we can address the mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. And I'm now very happy to introduce our presenter for today, who is Dr. Adam Wilk. Dr. Adam Wilk is a health economist and health policy researcher at Emory University's Rollins School of Public Health in the Health Policy and Management Department. He has 18 years of experience in Medicaid consulting, technical assistance, and research. Dr. Wilk's research focuses on access to care for low-income individuals and underserved populations, and particularly those with chronic illnesses, and state financing and policy related to providers' operations and care. And now I'm very happy to turn it over to Dr. Wilk.
Thank you very much, Kelly. Really appreciate the introduction, and welcome, everyone. Looking forward to speaking with you all for the next several minutes about Medicaid, Medicaid managed care, and school mental health. If we encounter any more challenges, Kelly, with the screen over the course of the next several minutes, please let me know, and we can try to pivot pretty hard to whatever technical solution needs to happen. All right, so let's dig in. The plan for today is as follows. I will walk us through our learning objectives first, and then I'll spend most of our time today talking about Medicaid billing requirements and how those can vary across Medicaid managed care plans as well as across states. Throughout the conversation, I will also highlight opportunities to learn more about Medicaid managed care and Medicaid managed care plans in your state, including opportunities to engage with Medicaid managed care plans directly or through intermediaries to stay apprised of what changes may be occurring with respect to those requirements and how those requirements may play out differently across Medicaid managed care plans. Then we'll wrap up and do some Q&A at the end. All right. Here are your learning objectives. I am hopeful that by the end of this hour, you will be able to specify the requirements that have to be met in order to bill Medicaid or specifically Medicaid managed care plans for school mental health services. That's the big goal. I also hope you'll be able to discuss ways in which these requirements may vary across states, as well as within your state or any state across Medicaid managed care plans. And then finally, I hope you'll be able to describe opportunities to learn about Medicaid managed care plans in your state and how to meet their requirements which you must meet in order to get your school mental health services paid for. All right. One of the last things I want to do here, though, before we dig into the meat of today's presentation, is to learn a bit more about you all and your experience with Medicaid and with Medicaid managed care. So, Kelly, if you wouldn't mind pulling up the first poll question here, we'll give everyone an opportunity to tell us how much experience they have working with Medicaid to pay for school mental health services. Please choose the option here that best represents your experience. All right, Kelly, when you see we've got a quorum of responses, we can take a look at the results here. Beautiful. We've got a pretty wide distribution of experience here. The plurality with no experience, welcome. I'm glad to give you some baseline information about Medicaid and Medicaid managed care in this context. But then we also have some more experienced folks between 1 and 3 years, between 3 and 10 years. That's great. This webinar is meant to provide information that could be, I don't know, a level 200 version class of Medicaid and school mental health, just because Medicaid managed care ends up throwing a wrinkle in things that you might consider confusing to start with. So I will also be highlighting some resources a little bit later in this presentation that may be useful to all folks at all levels of experience. But particularly those of you with relatively lesser experience with Medicaid and paying for school mental health services. All right, so let's move to the second poll question. Maybe for those of you with a bit more experience, this will yield some potentially interesting variation. This question asks you to describe your experience working with Medicaid managed care plans to pay for school mental health services, as opposed to Medicaid more generally. The distinction between the answers is the first one is no experience. The second one is some experience working with Medicaid managed care plans, but only outside of the school mental health context. The third option is some experience working with Medicaid managed care within the school mental health context. And then the last option, a lot of experience. All right, Kelly, again, I'll defer to you. When we have a quorum, we'll take a look at those responses in summary. Beautiful. All right, so a larger percentage of folks have no experience working with Medicaid managed care plans, either in general or perhaps only outside of the school mental health context. So that's great. This is a great place to start for gathering information about this. For those of you who have some experience or a lot of experience working with Medicaid managed care plans, there will be an opportunity later on in this webinar for you to highlight perhaps some of your own experiences and challenges you may have experienced in working with Medicaid managed care in this context that might be useful for others to hear about. Fantastic. Thank you so much. All right, so then the last thing I wanted to do before we get into the real didactic portion of this webinar is to highlight a resource that our center has prepared and is very proud of. It's called Medicaid and School Mental Health Services FAQs. It is a detailed, somewhat lengthy report. It pushes 30 pages, but it provides a lot of information about how to finance school mental health services through Medicaid. And it's organized in using what we would consider frequently asked questions about Medicaid in this context. Chapter 9 in this report, and by the way, when I say chapters, don't get intimidated. They're really just 1 or 2 pages each. Chapter 9 in this report is called What is Medicaid Managed Care? So if you're looking for some more in-depth guidance, maybe something that's a little bit more evergreen in guiding your understanding of Medicaid managed care and its role in this context, I would direct you to this report. But even if you want to learn more about many other dimensions of Medicaid and how it works in this context, please take a look at the link in the chat, click it, share it, circulate it as far as you like. Of course, it's a free resource, just like all of the other resources on the Southeast Mental Health Technology Transfer Center website. And please avail yourself of all of the information it contains. All right, so I told you Chapter 9 is what is Medicaid Managed Care? Well, I'll give you a brief synopsis of that here, just for context with this presentation. So first, Medicaid, for those of you who are not familiar with the Medicaid program more generally, it is the largest payer for behavioral health services in the US. It's a state-based insurance program, and it is also a major payer of school mental health services and one of the biggest insurers of children. As of July 2022, a survey was conducted, and it was determined that nearly 40 states, plus the District of Columbia, enrolled at least some of their children in the program in a Medicaid managed care plan. And in those states, the survey also found that Medicaid managed care is the dominant source of coverage. So among those 39 states plus DC, 94% of Medicaid-enrolled children were in a Medicaid managed care plan. What does that mean, really? What it means is the state is not administering Medicaid benefits directly. The state is not paying providers for their services rendered to these children. Rather, the state has contracted with commercial insurance plans to administer benefits on their behalf. Those plans are then called Medicaid managed care plans. So that's what this is. The state has entrusted the responsibility of paying for services to a private contractor, a commercial insurance plan. That's what it is at its core. So if you have some experience with commercial insurance, either for yourself or for some of the students in your community, this is analogous. It's just within the Medicaid context. There's only one state, I would add, in the Southeast region that does not use Medicaid managed care to administer benefits for children. That's Alabama. All 7 of the other states in our region leverage Medicaid managed care for a large proportion of their children. All right, so there are a couple of key nuances I wanted to highlight off the top also. One is that there are usually multiple Medicaid managed care plans operating in any given state. In the Southeast, again, outside of Alabama, there are between 3 and 11 plans operating per state. 11 feels like a lot. I'll tell you that's only one state in our region, that's Florida. And Florida, like a handful of other states, operates its Medicaid managed care contracting system separately for different regions of the state. So this number 11 captures a wide range of regions and sums them all together across the state. So within any given region within Florida or within any given state outside of Florida, we're talking about 2 to 5 plans operating. So that's a little bit more manageable than 11, even though it's still more than one plan operating. And so I can certainly understand how that might sound a little intimidating. That's one of the main purposes of this presentation, is to highlight ways in which these plans may operate somewhat differently from one another. These are the things you need to focus on in order to operate in a state that seeks to pay for services through Medicaid managed care. Now, another important nuance, it pertains to how the state contracts with these plans. Some states have carve-outs. So let me start by first saying every one of these contracts with Medicaid managed care plans spells out a full set of services that the plan is responsible for paying for. And you can imagine most Medicaid managed care contracts are the comprehensive variety, and so they would cover general physician services, hospital services, emergency department services, mental health, substance use, durable medical equipment, the works. But in some states, 12 in this survey that was administered in July 2022. And it says 36%. That's of the states that have some Medicaid managed care operating. 12 states have carved out at least some outpatient specialty mental health services from that contract. So the main Medicaid managed care plan that enrolls these children would be responsible for paying for most services, the physician services, hospital care, often pharmaceutical benefits, sometimes those are carved out too. But then outpatient specialty mental health services may be paid for through some kind of separate entity. Different states determine who that entity is differently. It might be the state itself that administers those benefits and pays for outpatient mental health services, or it might be another company that looks a lot like a Medicaid managed care plan. It might be a specialized behavioral health managed care company. The reason I bring all of this up is because even if you anticipate going in that you'd have to keep track of 2 or 3 or 4 plans, different sets of requirements, policies, etc., in fact, these plans may actually subcontract, or the state may effectively subcontract with additional entities, these specialty behavioral health managed care companies, or the state may have different policies. So in fact, 2, 3, or 4 may actually underestimate the number of different sets of requirements you'd have to keep track of. Again, one of the points of this presentation is to demystify that and help direct your attention to the few places in which differences across plans really matter. But I did want to give you this heads up right off the top. The reason we're focusing in on those specific requirements that may vary is because multiple plans may be operating. There may be different sets of requirements to keep track of. All right, so that's the foundation of Medicaid managed care. And here's the foundation of Medicaid payment for school mental health services in general. There are 4 requirements that have to be met in order for Medicaid to pay for school mental health services. The 4 are listed on this slide. The service has to be a Medicaid covered service. The recipient of the service, the student client, must be enrolled in Medicaid. The provider administering the service or providing it, delivering it, must be a Medicaid certified provider. And the setting where the service is delivered, since we're talking about school mental health services, this is the school must be a Medicaid accepted setting for that service. Those are the 4 requirements. There are nuances under each of them that I'm going to walk through over the next several slides, but this is the core of it. And if you can walk away from this presentation just taking away this information, for those of you who are just getting into Medicaid, this is a great place to start. All right, we're going to start with the service. And so this first requirement requires Medicaid must cover the service. It must be a listed service on the lists of services that Medicaid covers for your state. There are direct services that Medicaid can pay for, things like screening services or counseling or so forth. And then there are administrative services that Medicaid can often pay for too, things like outreach and enrollment services. Figuring out how to get Medicaid to pay for those is a little bit more complicated. It's often administered through a different system than your standard claims-based payment system. We're not going to spend a lot of time on that, but I would say there is a resource we will highlight later on in this presentation that directs you to some more information about how to handle administrative services in this context. For the most part, though, we're going to be thinking about a range of services, both mandatorily offered by Medicaid programs and optionally covered by Medicaid programs that Medicaid managed care plans will more often be responsible for. So I say mandatory and optional. There's a list of services that all state Medicaid programs have to cover, and there are lists of services that only some states cover. You can gather information about which services are covered in your state, usually on state Medicaid websites. There's usually a section listing covered services or Medicaid benefits, and sometimes it's a website section that is intended to inform providers more than it is beneficiaries. So you might have to click on the For Providers subheader on the website in order to find some of this information in a condensed format. I would highlight too that it's not just that Medicaid has to cover the service. Sometimes Medicaid requires that a certain diagnosis code be listed in order to pay for a particular service. So it's not just Medicaid must cover the service, it's Medicaid must cover the service for this particular condition. That's not true for all services, but it is true for a great many of them. So I wanted to draw your attention to that. It'll also be something that comes up again in the context of Medicaid managed care. But again, going to where to look, here are a few examples of state websites that provide information about what services are covered in the state Medicaid program. One from Florida. This is Florida's state Medicaid program's website. In South Carolina, you actually have to download a Medicaid member handbook from a particular section of the website in order to see this information. This, of course, once you download it, may be outdated relatively soon after you download it. So you may have to periodically check back and see if there's a new version available for download. Whereas, of course, the information posted on Florida's Medicaid website might be something you can track through other systems, RSS feeds, or what have you. All right. So here's where Medicaid managed care can throw a bit of a wrinkle into this first requirement that Medicaid must cover the service. Medicaid managed care plans may have different terms of coverage. I mentioned already that certain services may be covered only if specific diagnosis codes are also listed on claims for those services. Well, an easy example is that different Medicaid managed care plans may have different lists of which diagnoses are acceptable when you're trying to bill for a particular service. But there are additional examples that I wanted to draw your attention to here. In the context of psychotherapy services and assessment, we are aware of at least a couple of states that have imposed certain limits through their Medicaid managed care plans. And those restrictions or constraints may be imposed differently. There may be different constraints across plans. For example, some initial psychotherapy services or assessments may be covered only if a referral is documented. And so you need to learn what the system is for documenting a referral when billing that particular plan. Sometimes it's not just a referral that's required. There may be some approval process that you would have to go through first. Prior authorization is the term given for where the plan gives consent to pay for a service that is yet to be rendered. So that's one requirement that Medicaid managed care plans might impose. Be a requirement that prior authorization be received before a referral can be made or the service can be rendered. Some plans may impose benefit caps. So there may be just a fixed number of psychotherapy services that an enrollee may be entitled to have paid for in a given calendar year, for example, before additional constraints may be imposed. And in some cases, that where there is a cap, coverage may be extended above the cap if the provider obtains reauthorization. So you may need to get prior authorization up front and then reauthorization, very similar process, after you have exceeded the cap for students who might need more than the cap covers. All of these are different terms of coverage that should be listed in some document, maybe a member handbook, maybe a provider handbook from the Medicaid managed care plan. And so you should have access to this information through some public documentation. And yet, plans may give relatively little notice before making changes to any of these coverage terms. This has been a problem. I am aware of at least a few studies that have observed some outdated information being posted on the website that has not been updated efficiently. And so it is something you have to watch out for, but I do think oversight of how current this information is on any given website has improved. And so this may be less of an issue than it has been historically. All right. Now, I also mentioned that there are, between 2 and 5 plans enrolling Medicaid beneficiaries in any given region or state. And so I just want to reiterate that when we're talking about distinct terms of coverage here, what this means is there may be as many as 2, 3, 4, or 5 different sets of coverage terms to be familiar with if you want to try and bill each of these different Medicaid managed care plans for the same service. It's a bit annoying, you might say, from the perspective of the provider. But I would say for the most part, the differences across these plans tend to be sporadic. So you won't see major differences across all plans for every service, but you will need to keep track of where there are differences. Okay. So that's where Medicaid managed care can throw a bit of a wrinkle into the first requirement, that Medicaid covers the service. Now we're going to move into the area, the requirement pertaining to the recipient, that the student client is enrolled in Medicaid. And I'm happy to report that this is actually an area where Medicaid managed care does not make a very big difference in your experience as a school, a district, or a community provider. All right, but let's talk about what this requirement is first. So the student client must be enrolled in Medicaid. Medicaid is an entitlement program. So if you are eligible for Medicaid, you have the right to enroll. There are no constraints, caps on the number of beneficiaries that can be enrolled in Medicaid. That's what it means for an individual to be entitled to the benefit here. But it does mean that what you need to focus on are these eligibility categories, groups of individuals who may be eligible for Medicaid on the basis of their characteristics. For children, those characteristics are usually age, income, and whether they have a particular disability or long-term condition that might make them eligible for one particular category of Medicaid versus another, within Medicaid versus another, I should say. There are some categories that every state has to offer, and then there are some optional categories where states may have some discretion as to whether they offer Medicaid benefits to this distinct group. The income limit, that criterion is usually the binding one for most children. Income-based eligibility categories enroll the most kids in Medicaid. And so there's some variation here across states too in what these income limits are. But fortunately for each of you, for the most part, you only need to keep track of what the income limits are for your state. That should allow you to provide the information that any student, client, or family would need in order to make some initial judgment as to whether they're eligible for Medicaid. All right. So these eligibility categories, the income limits, there are mandatory minimums set by the federal government, and different states can set higher income limits to enroll more kids if they choose. And different states cover different populations at different income levels. Fortunately for you, again, all you really need to keep track of are the rules as they are set up at your state, within your state. Where can you look for this information? Well, usually state Medicaid websites have a section with terms of eligibility and links to apply for coverage. I'll show you a few examples in a moment. If you're looking for information across multiple states, or if you're looking for this information boiled down nationally, resources like Medicaid.gov or the Kaiser Family Foundation might be good resources to look at. A quick note on the fine print related to Medicaid eligibility. Some individuals may retain coverage only if eligibility is recertified approximately every 12 months, sometimes more often, sometimes less often. There's a movement right now among many states to allow for continuous Medicaid enrollment for children beyond 12 months, where this wasn't always the case. But you may have heard about changes in eligibility or recertification rules under the COVID-19 public health emergency. During that window, continuous Medicaid coverage was guaranteed, but then some states have started to roll that back. But all of this action has drawn attention to the problem of discontinuous Medicaid coverage for children. And so many states are moving towards continuing coverage without recertification requirements beyond 12 months. So that's something to look out for, possibly in your state. Also, shouts to Oregon for being one of the states that has led the charge in extending coverage for children beyond the first 12 months of enrollment. Here's a few examples of what it looks like to track eligibility information in a given state. The Georgia Medicaid website has a link where you can apply for coverage, and through that link, you can see what the eligibility criteria are and whether you meet them. In Kentucky, a single website administers eligibility and offers coverage options within the state health insurance exchange. So it may not look like a Medicaid website, but it is in fact the place to go for information about Medicaid and also for information about other sources of insurance coverage. That's called Connect, K-Y-N-E-C-T. Okay. So this is normally, again, where I would highlight where Medicaid managed care might throw a wrinkle into things. And for the most part, this requirement is free of Medicaid managed care wrinkles. Eligibility rules do not vary by Medicaid managed care plan. Those eligibility rules are set by the state. Now, the state can also determine which eligibility groups are enrolled in Medicaid managed care, and it may not be all eligibility categories that are enrolled in Medicaid managed care. And for those groups that do enroll children in Medicaid managed care plans, beneficiaries may be enrolled in a Medicaid managed care plan from jump, from initial enrollment, maybe automatically. There is no option in those setups for receiving benefits through the state as opposed to a Medicaid managed care plan. Yet there may be some states where there is a voluntary nature to enrolling in Medicaid managed care. And children may have the option, at least some children may have the option to enroll in state-administered or sometimes called fee-for-service Medicaid. There are also some setups where states may enroll individuals in the Medicaid managed care plan of their choice. And there would be some 60 or 90-day window when new enrollees would have the opportunity to designate which plan they want to be enrolled in for whatever reason, maybe based on provider networks or accessibility. And then the state would enroll you in a Medicaid managed care plan, maybe by random selection or based on some algorithm if the beneficiary does not designate which plan they want to be enrolled in during those first 60 to 90 days. So that's where we see a little bit of nuance related to Medicaid managed care. It has to do with whether it is required that Medicaid managed care be the source of your coverage if you're enrolled in Medicaid, or when you get to pick a plan, when you get enrolled. But once you're enrolled, you're usually enrolled in a Medicaid managed care plan, and there's no more there are no more variances across plans in terms of things like recertification or determining eligibility. So at least here, we're safe. All right, let's move on to the third requirement. The provider is a Medicaid certified provider. Medicaid managed care definitely plays more of a role in informing whether this requirement is met. We'll get to that in a moment. But in brief, this requirement holds that providers have to be Medicaid certified in order to receive Medicaid reimbursement. You can't bill unless you're Medicaid certified. What does that mean? Well, it usually means that the provider must meet the state's licensure or certification requirements, depending on what provider type. And sometimes, often, providers must complete an application, usually through the Medicaid website, in order to get on the Medicaid certified provider list. All right. So with that as the basics of this requirement, there is some variation across states with this requirement in that different types of providers may be eligible or ineligible to become Medicaid certified. And in fact, this is one area in which states are often changing policy, including specifically in the context of school mental health, for reasons that I'll get to in a little while. So school nurses, for example, have recently become eligible to become Medicaid certified in a few states that I'm aware of. Massachusetts was among the first states to designate school nurses as potentially Medicaid certified. But many other states do not allow school nurses to become Medicaid certified. And so you should be aware, and most providers will be aware as to whether they can become Medicaid certified. Where can you look for information about this? Where there's usually a provider-facing section of the state Medicaid website, which would describe terms of certification and provide a link for providers to complete the application and seek certification that way. I would highlight, though, that in some states, Medicaid managed care plans have actually been delegated this responsibility for certifying Medicaid providers. And I'll show you an example of that in a moment. Now, a bit of fine print related to this requirement. Some services can be billed to Medicaid only when provided by certain Medicaid certified provider types. So only some provider types can become Medicaid certified, And then conditional on Medicaid certification, there's actually an interaction between the service-related requirement and the provider certification requirement. Only some Medicaid certified provider types may be eligible to bill for some services. For example, some states distinguish between licensed clinical social workers certified in the state versus non-clinical social workers. Perhaps only the clinical social workers would be able to bill for certain counseling services, whereas the non-clinical social workers would not be able to. Again, most providers should be aware whether they are eligible to become Medicaid certified. That would be a good place to look for information about any given particular provider type that you're thinking about hiring or partnering with. All right. So here are a few examples of how Medicaid may handle Medicaid's provider certification in their state. Alabama has a section of its website that is titled Provider Enrollment and Forms, which I will tell you is about provider certification. I don't like using the word enrollment for this, though some terminology varies across states. I'm giving this example because it's not always the term provider certification that you want to look for in order to find the particular section of the website for this. I'm also showing you an example from TennCare, that is Medicaid program in Tennessee, where a Medicaid managed care plan, a TennCare plan called AmeriGroup, has the portal where providers can become Medicaid certified. Click the link on this particular site, and you'll have the opportunity to apply. There is no such form, likewise, on the TennCare website itself. All right, so there's the example of how Medicaid managed care can support Medicaid certification for providers. But here's another wrinkle where Medicaid managed care is important to note. Within Medicaid managed care plans, providers may or may not be in network. Now, for those of you who are familiar with commercial insurance or Medicare Advantage, Medicaid managed care plans very similarly operate their own provider networks. And so providers negotiate on an annual basis what fees they might accept from any of these plans, Medicaid managed care, commercial insurance, Medicare Advantage, all of them, and make some determination about whether they want to participate in network as a function of this negotiation. Of course, the Medicaid managed care plan also has something to say about that. And so if you're working with a provider who may be Medicaid certified, they may still be out of network for at least some of the Medicaid managed care plans in the state. And this information may change over time. Now, Medicaid managed care plans usually maintain directories of providers that are in network for their plans. But like some of the information I described earlier in the context of the service-related requirement, some of this information may at times be out of date. This information about in-network or network participation by providers can change in between years, and sometimes it may take a while for the provider directory to be updated on a given website. So I just wanted to highlight network status is a really important way in which Medicaid managed care adds another level of complexity to billing Medicaid for services here. And just to put a finer point on it, if there are 2, 3, 4, or maybe 5 plans enrolling Medicaid beneficiaries in a given area, some providers may be in network with one plan and not with the other or any of the others, and their in-network status may change over time. Usually the negotiations related to network status take place annually. So if you are an LEA or you're a provider organization considering participating in Medicaid managed care networks, I just wanted to highlight that these negotiations are a regular thing. It's not like you can work out network participation with a particular plan once and then take it for granted that that'll stay the way it works for perpetuity. This is an annual kind of deal, and so there are additional administrative burdens associated with maintaining network status with these plans. There's also potentially another wrinkle here where who employs the provider matters. Some Medicaid managed care plans may have different rules for Medicaid provider certification if the provider is LEA employed or a contractor to the LEA versus if they're a community-based provider. We've only seen one or two instances of specific distinctions between school employed providers versus community-based providers when thinking about whether a Medicaid provider can be in network or Medicaid certified for school mental health services, but it can happen. We found one example in North Carolina and another example in South Carolina. The North Carolina one, I think, changed over time, so it's no longer an issue, but it may still be an issue in other states. I also wanted to highlight this particular website for a Medicaid managed care plan in South Carolina, which spells out how to bill for school mental health services when you are an LEA, when you are, as an LEA, an employer of someone who might be a provider and bill for school mental health services. There's a lot of rich information on this website. I'm really kind of taken aback by how robust this resource is. It's not a very common thing that Medicaid managed care plans will provide this much information specific to the context of billing for school mental health services. So we're putting the link to this particular Medicaid managed care plan website in the chat now. And I think it's worth checking out so that you can see how at least one state deals with billing for school mental health services in particular, and one plan in particular within that state. Don't take it for granted that how it works here with this one plan and one state carries over to how it would work in your state. But I think it may be a nice template for many states and many Medicaid managed care plans to work with in order to make this a more accessible system for LEAs who might not have a lot of familiarity with commercial insurance or billing insurers generally, but want to make school mental health services accessible to individuals who are enrolled in Medicaid managed care plans. All right, so one more requirement to go, and that is the setting. That is, the school must be designated as a Medicaid acceptable, as a setting that is acceptable to Medicaid and in turn Medicaid managed care plans. So I have mentioned this in many presentations previous, but the whole policy landscape related to the school as an eligible setting changed in December 2014 when the federal agency, the Centers for Medicare and Medicaid Services, issued new guidance related to the so-called free care rule. Under the old rules, schools were not allowed to bill Medicaid for services that they provided for free to other individuals, like the uninsured, or individuals who were enrolled in commercial insurance plans, but plans with whom the schools had not yet worked out some kind of formal agreement. So it used to be you couldn't bill Medicaid for those services, but as of December 2014, that interpretation changed. Now you can bill Medicaid for services, even if you're providing them for free to others. And many states have been working pretty hard over the last decade to try and implement this guidance and unravel many other constraints on schools billing Medicaid for mental health and other services in accordance with this new guidance. It's a complicated policy landscape, and so not all states have fully implemented this new guidance as of a decade ago, or nearly a decade ago at this point. But piece by piece, states are making progress. I've talked about some of these reforms in previous presentations, so I would certainly encourage you to check out some of our other resources and webinars to learn more about that. All right. So where to look for more information about this? Well, the entity called the Healthy Schools Campaign, sometimes in some forums called Healthy Students Promising Futures, they have a website that tracks state actions concerning the free care rule and its implementation in each state. I'll show you that in a moment. And then one other key note is that different states may need to take different actions in order to implement the free care rule. So it's not as simple as just looking for the presence or absence of a particular law or policy to learn where your state is in its implementation of the free care rule, unfortunately. We've looked for it and it just doesn't exist. So here's the resource that I mentioned a moment ago, the Healthy Schools Campaign resource that highlights where different states are related to the free care rule. And I bring this up mainly to offer a caveat that these maps, which supposedly identify which states have expanded Medicaid coverage, that is, fully implemented the free care rule in schools, and which states are in process, these state designations are not specific to mental health. So for example, Georgia, where I'm speaking to you from, has expanded its free care rule terms to include school nurses and billing for services that are not mental health services. But if a school nurse tried to bill Medicaid in Georgia for mental health services, they would find that the policy does not currently support that. So in fact, this map is a bit misleading for Georgia, and I think it can be for other states too, if you were to try and use it and extrapolate where your state is relative to billing Medicaid for school mental health services. So useful resource, but important caveat. Okay, so here's where Medicaid Managed Care enters into this particular requirement. I mentioned previously some circumstances where certain providers or provider types may be eligible to bill for certain services, but not others. Well, here's another example where there may be intersecting requirements where the setting plays in. It may be that the school is an eligible setting for a particular service, but only if the service is rendered by a particular provider type. Whereas if the service is rendered outside of a school, maybe a different set of provider types and a different set of services may be billable. It's complicated, I know. All the more reason to keep track of the different requirements in different plans within your state. Here's a few examples that we've become aware of, and I just wanted to present them briefly to try and illustrate this. So in 2019, North Carolina implemented a new policy that allowed LEAs to bill for certain services, including counseling, for all Medicaid-enrolled students. It used to be that LEAs couldn't, and so that was a big change. And yet, North Carolina has also implemented Medicaid Managed Care in the state where it previously didn't have it. And there is some flexibility within North Carolina's Medicaid Managed Care program where plans can restrict which LEA-employed provider types can bill for these services, including counseling. I don't believe there are significant differences across Medicaid Managed Care plans in North Carolina with respect to this point. However, that doesn't prevent different plans from changing their requirements down the road. So it's still worth monitoring. Another relevant episode to highlight came about in South Carolina, where starting in 2016, they had a program that pre-existed called the Rehabilitative Behavioral Health Services Program, which included a lot of outpatient mental health services. And that benefit was administered by the state for a long time. But as of 2016, this benefit was integrated, carved into these Medicaid managed care contracts. However, schools, LEAs that had been participating in the RBHS program prior to 2016 started dropping out of the RBHS program because they found other requirements imposed by Medicaid managed care plans to be too cumbersome. And so the number of participating LEAs in the RBHS program dropped from 33 to 12. That sounds like a big drop, and it is, but I would just point out that there are many more school districts in South Carolina than 33. So not all school districts were participating already, and it may have been that many of them may have dropped out of the program anyway, regardless of the Medicaid managed care carve-in. But I just bring this up to highlight that at least some school districts have reported that Medicaid managed care plans additional requirements, including related to provider type restrictions or diagnosis code restrictions, et cetera, may impose additional burdens. All right. So you certainly need to keep track of these different plans requirements, particularly where they may be intersecting across provider type, setting, service, and so on. You can keep track of them a few different ways, but I wanted to highlight at least this one opportunity other than the resources I've highlighted before. One important thing to do is just to identify which Medicaid managed care plans are enrolling beneficiaries in your area. That information is usually pretty readily, can be readily obtained through the Medicaid website, particularly in portals that are patient or enrollee facing. And then it is up to you often to keep track of the policy differences across these Medicaid managed care plans. And that is hard. It can be hard, particularly if the documentation on the websites is outdated or incomplete relative to some of the questions you may have. So one recommendation I wanted to make here is to maintain a primary point of contact with each of the Medicaid managed care plans that operate in your area. Someone that you can trust, someone who will be responsive to your emails and will have some perspective on the kinds of FAQs that LEAs would have or community providers would have related to billing for mental health services in schools. I've heard anecdotally from at least a handful of districts in a few states in the Southeast region that they have successfully maintained these kinds of communications with Medicaid managed care plans in their state. It can be done, though it does often, there may be a few wrong doors that you would open first before you identify who is in fact the right person to be your primary point of contact. Another strategy that at least one state in the Southeast has used, I think, is really smart and maybe a model for other states to follow going forward. And that is to entrust a state agency like the state education agency or the Medicaid agency, perhaps, to broker those communications between education entities or community providers and the Medicaid managed care plans. That is, make it so that the state agency or the Medicaid agency, education, Medicaid, what have you, maybe the Department of Mental Health, they would be the go-to resource for answering questions related to Medicaid managed care for LEAs, for community providers, for whoever is the relevant provider set in your state. Tennessee, for example, partnered with its TennCare agency, that's again the Medicaid program in the state, to host a series of regular gatherings between leadership from Medicaid managed care plans and leadership from the state's education authorities to work out a lot of these arrangements and simplify things for LEAs who might be interested in billing for mental health services. I know these conversations were very active around 2018 and 2019. And I don't know that they are quite as active now, but I think it's a great model for other states to consider, or Tennessee even to return to, as a way to simplify and minimize the burden on LEAs of keeping track of all of these different requirements across Medicaid managed care plans. All right, so as we're running out of time here, I wanted to highlight an opportunity now for folks to input into the chat any information you may have, challenges that you may have encountered, you as an LEA or a community provider, yourself or someone you've partnered with, challenges you may have encountered when working with Medicaid managed care plans to pay for school mental health services. If you have any challenges that you've encountered or anecdotes you'd like to share with the group that others can learn from, we would love to see you enter it into the chat now. We will also monitor these, anything you would add into the chat. So perhaps we might be able to address some of these issues during the Q&A portion in a minute or two here. So that poll question, if such as it is ongoing. I'm gonna move to the next slide and highlight a few resources, but please continue to type in the chat. All right, so I've mentioned a few times that our Southeast Mental Health Technology Transfer Center has produced a number of resources related to Medicaid and the financing of school mental health services. The best place to go to find these resources is our School Mental Health Resource Catalog. We regularly update this, and so even as soon as next month or the month after, you'll see information in this resource catalog about today's webinar, as well as all of the myriad other resources we've put together related to Medicaid and the financing of school mental health services, which is something of an area of focus for our center. So check out the link to the resource catalog. It's in the chat now. Again, feel free to circulate this and download and avail yourself of any of these free resources. I also mentioned previously the Medicaid and School Mental Health Services FAQs report. It's our top Medicaid-related resource. Please do take advantage of it and download it and circulate it. And then here's a few other resources I wanted to highlight. One is a webinar that I gave a year or two ago called Medicaid and School Mental Health 101. So if you're among those folks that reported earlier on that you have less experience working with Medicaid or Medicaid managed care, this might be a great place to go for some slower paced, more foundational information about Medicaid and how it might work in the school mental health context. I also promised earlier that I would highlight a resource related to billing for administrative expenses like outreach and enrollment services. Here on this slide, when you download the slides, you'll have access to an infographic on that particular issue. And then if you'd like a guided tour of all of the resources that we have related to Medicaid and school mental health, we also led a webinar that oriented folks to nearly 20 different resources. So if you're looking to get some guidance about which resources are most important for you, check that out. All right, so now we're going to move to the Q&A portion. I hope you all have had a chance to input into the chat some questions we've been monitoring. And I'll ask my colleagues here at the Southeast Mental Health Technology Transfer Center to highlight any for me that they've come across so far. Otherwise, please feel free to enter your questions into the chat. And if we don't have time to get to them today, because we are running a bit short of time, please feel free to provide enough information that we can follow up with you and perhaps provide some additional guidance.
So far, we received a resource from Carrie that is for folks in Tennessee. So anyone here from Tennessee should check that out. But no, I haven't seen a question come through yet.
Great. Thank you very much. And thank you, Carrie. I appreciate you sharing that resource. I see it, Carrie Virgo. For those of you who are from Tennessee, look for Carrie's addition to the chat. Very helpful resource. All right. I'm going to hold the floor here for one more minute or so to see if any questions come in. But very soon we will ask you to complete an evaluation form. My colleague Kelly mentioned it earlier, but it's very important for you all to complete this evaluation. It's important for our funding. It also gives you an opportunity to receive a certificate of attendance for today's webinar, if that's of importance to you. Please, again, note that there are 2 sections to the evaluation. So you'll be directed to the second part once you complete the first. And we do value your input and feedback on today's webinar through both of those forms. Kelly, would you add anything at this time?
No, I think you covered it very well. I will put my email in the chat. If anyone has trouble accessing their certificate of attendance, they can always just send me an email.
All right. Well, unless we receive any last minute cues in the Q&A chat here, then what I think we'll do is we'll stop the recording and we'll hang around for a few minutes and